Isang mapagpalang araw po sa ating lahat. I am Vincent Luage, currently taking a master's degree in Information Systems. For today's topic, I will discuss the program and science communication. To start with, let's tackle the program communications first. Now, what is a program communication? According to McKee, program communication which involves identifying, segmenting, and targeting specific groups with tailored messages and pertaining programs using various mass media, maaaring sa pamamagitan ng telebisyon, radyo, or pahayagan, and interpersonal channels. Maaari namang itong sa pamamagitan ng seminar, workshop, o harapang pakikipag-usap, traditional and non-traditional. Now, to light up on what McKee said, let me give you some examples of a program communication according to his definition. Example number 1, the Bawal Bastos Anti-Sexual Harassment Campaign. So why it fits McKee's definition? First is identifying. The campaign focuses on raising awareness about the Safe Spaces Act, Republic Act 11313, and targets individuals vulnerable to sexual harassment in public and online spaces. The second one is segmenting. It addresses different groups including women, LGBTQ+ individuals, and students and workers who are commonly affected by this type of harassment. The third one is targeting. The company uses posters, social media infographics, and public service announcements to educate the public on their rights and legal remedies. The mass media interpersonal channels. The government collaborates with media and outlets, schools and workplaces to disseminate information through seminars, TV ads, radio discussions, and local media campaigns. Another example of a program communication is the National Dengue Awareness Campaign. So why it fits again to McKee's definition? First is also the identifying. The campaign identifies at-risk populations such as communities in dengue-prone areas, parents of young children, and local health workers. The second one is segmenting. It segments the audience based on factors like location, age, and occupation. For the example, students, barangay officials, or medical professionals. The third one is targeting. It targets these groups with specific messages such as prevention measures, symptoms to watch for, and available medical support. Mass media and interpersonal channels, TV and radio commercials, posters, and social media infographics raise awareness at a national level. Now, let's move on to another topic, which is the science communication, or in other terms, science and technology communication. According to Burns O'Connor and Stockton Mayer in 2003, science communication, or SciComm, is defined as the use of appropriate skills, media, activities, and dialogue to produce one or more of the following personal responses to science. The I-U vowel analogy, which means the awareness, enjoyment, interest, opinion forming, and understanding. The definition provides an outcomes type view of science communication and provides the foundations for further research and evaluation. Let's dive to the examples on most notable well-handled science communication. Our first example is the World Health Organization's communication during the COVID-19 pandemic by the year 2020-2022. The World Health Organization provided real-time updates and transparency by providing daily situation reports and real-time updates on COVID-19 cases, mortality rates, and emerging variants. These updates were shared through their official website, press conferences, and social media, ensuring accessibility to a global audience. Regular press briefings featured WHO experts like Dr. Tedros Adhanom Ghebreyesus, who communicated developments and clarified concerns. When it comes to myth-busting campaigns and counterfeiting misinformation, as the World Health Organization launched the Stop the Spread campaign to debunk myths about COVID-19, vaccines, and treatments. They collaborated with social media platforms like Facebook, Twitter, and TikTok to flag misinformation and direct users to credible sources, and clear public health guidelines as the World Health Organization released standardized health protocols on mask wearing, social distancing, hand hygiene, and quarantine measures. World Health Organization also updated its recommendations and ensured transparency in explaining changes to the public as scientific understanding evolved. They also provided clear visual aids, animations, and infographics help simplify complex medical concepts for the general public. To further substantiate the claim, a Pew Research Center survey in 2020 found that a median of 63% of adults across 40 nations believe World Health Organization handled the COVID-19 pandemic well, with majorities in 12 countries approving its response. Despite some exceptions, the overall perception was positive, highlighting World Health Organization's effectiveness in providing real-time updates, myth-busting campaigns, and clear public health guidelines. Moving on, let's give another example, the HPV vaccine awareness campaign. There are 4 key strategies in the HPV vaccine awareness campaign. The first one is clear science-based messaging. The campaign focused on scientifically accurate and easy to understand messages like HPV vaccination prevents cancer, the vaccine is safe, effective, and recommended for preteens before exposure to HPV. Both boys and girls should be vaccinated to prevent HPV-related diseases. The next key concept is multi-channel communication approach. They use traditional media like TV ads, newspaper articles, billboards, and radio spots promoted the benefits of vaccination. They use also the social media engagement. Governments and health organizations use platforms like Facebook, Twitter, and YouTube to share vaccine testimonials, expert Q&As, and infographics. The next one is the influencer and expert endorsements. Medical experts, celebrities, and social media influencers were involved in spreading accurate information. The campaign highlighted personal stories of individuals affected by HPV-related cancers to encourage vaccine acceptance. Last but not the least is the addressing misinformation and vaccine hesitancy. Health agencies debunk myths like the vaccine causes infertility. It is false. It is clinically proven to be safe. HPV vaccination encourages promiscuity. It's another false. Studies show no correlation between vaccination and risky sexual behavior. Governments collaborated with fact-checking organizations to remove false information online.